Okay, so welcome to the deep dive. Today we're diving into a big one, something that affects pretty much everyone connected to Medicare, and that's Medicare fraud.
Yeah, that's right. It can feel like just a bunch of numbers and headlines,
Right.
but the reality is it has a real impact on you and the entire healthcare system.
Yeah.
So in this deep dive, we really want to give you the knowledge to understand what Medicare fraud is, how to actually spot it, and what steps you can take if you need to report it. Because at the end of the day, it's about protecting yourself and this program that so many rely on.
Absolutely. And, we hear a lot about this. It's kind of a scary topic. We hear billions of dollars vanishing every year, and that's according to, the big guys, the U.S. Department of Justice and the FBI.
Right.
And those aren't just figures on a page. That represents potential improvements in your healthcare.
Absolutely.
It could mean lower costs for everybody and, just the security of this system for the long term.
Right. When we think about it, all those lost funds could have been used for so many better things,
Right.
like better benefits,
Right.
potentially lower premiums for everyone, or even just making sure Medicare is financially stable for years to come.
Right.
But we also have to talk about, I think, one of the most concerning aspects of this,
Yeah.
the real harm that it can have on patients.
Right. Absolutely. It's not just about the money.
Exactly.
What about the patients themselves?
Think about it. We've talked about those unnecessary procedures. This is about people actually getting treatments that they may not even need,
Right.
which, as you can imagine, can lead to a lot of really negative health outcomes.
Yeah.
And beyond that, when things like this happen, it erodes trust in the whole healthcare system.
Right.
People start feeling like they're being taken advantage of.
Right.
It just creates this sense of doubt and mistrust in the whole process.
And today we are going to break it all down. What exactly Medicare fraud is, the red flags to watch out for, how to report it, and why preventing it is so important.
Yes, absolutely.
And to do that, we dug deep into official government sources. We talked to leading advocacy organizations just to bring you the most clear, up-to-date, and useful information.
Exactly. We want this to be something you can use. So let's get started. When we talk about Medicare fraud, what are we really talking about? What does this actually look like?
Yeah, let's get down to it. What does it mean for the everyday person?
At its heart, Medicare fraud is really about deception. It's about intentionally trying to get unauthorized benefits or payments from Medicare. The Centers for Medicare and Medicaid Services, CMS as it's usually called, has a more formal definition. Something about knowingly and willfully executing a scheme to defraud Medicare or to get money through false pretenses. But really what it boils down to is trying to cheat the system for financial gain. And that takes away resources that are supposed to be there for real healthcare needs.
Right, that makes sense. But can you give us some real-world examples? What does this actually look like when people are interacting with the healthcare system?
Sure. I think one of the most common examples is when you get billed for services or supplies that you just never received.
Right.
So you're going through your Medicare statement, you see a charge for a piece of medical equipment or a test, but you never got it. That's a huge red flag right there.
Okay.
Another thing we see a lot is what's called upcoding.
Upcoding. I've heard that term. What exactly does that mean?
So upcoding is when a provider bills Medicare for a more expensive service than what they actually did. For example, maybe you had a really quick basic checkup, but then they bill it as if it was a long, comprehensive visit.
Ah, so they're making it seem like they did more than they really did.
Exactly. It's about inflating the cost.
Right.
And we also see cases where diagnoses are misrepresented.
Misrepresented.
Yeah, so a provider might give an inaccurate diagnosis or even exaggerate an existing one just to justify ordering tests, doing procedures, or prescribing medications that aren't really needed.
That's scary because then it's not just about money. It's about people potentially getting treatments that could even harm them.
Absolutely.
Yeah.
And that actually leads to another type of fraud, performing treatments or services that are completely unnecessary. The only goal here is to get more money from Medicare.
Wow.
And of course, this can put patients at risk. It's a clear misuse of taxpayer dollars.
Yeah.
And then we've got kickbacks.
Kickbacks. Okay.
So kickbacks are when a provider gets some sort of payment, gift, or any kind of benefit for referring a patient to a specific doctor or facility. Now, this is illegal under federal law because it creates a huge conflict of interest. The provider might be making decisions based on what benefits them financially instead of what's best for the patient.
Right, that makes sense. It's really unsettling to hear about all the ways this can happen. We talked about the financial side of things, but I want to dig deeper into the other consequences of Medicare fraud,
Sure.
the ones that go beyond just the money.
Yeah, it's a much bigger picture.
Yeah.
As we've said, the financial cost is huge, billions of dollars lost every year,
Hmm.
but it's the human impact that we really need to focus on. Like we talked about with unnecessary procedures, people can go through treatments they don't need, and sometimes these treatments can have really bad side effects. It's not just about wasting money, it's about potentially harming people's health. And then there's the trust issue. When people feel like the healthcare system is corrupt, they might delay getting care, they might not follow their doctor's recommendations.
Right, they just don't trust the system anymore.
Exactly. It has a ripple effect.
Absolutely. And you mentioned identity theft earlier. How does that tie into all of this?
Well, unfortunately, criminals often target Medicare beneficiaries specifically to steal their personal information, particularly their Medicare numbers. And they use that information to file fake claims, often for services or equipment that the beneficiary never received.
Right.
Organizations like AARP have been tracking this for years, and they've seen countless cases where seniors have been victims of this kind of fraud.
So it's really about protecting people, not just some abstract program.
Exactly. Reporting fraud isn't just about protecting the government. It's about protecting individuals from real harm.
That's really important to remember. Okay, so let's get practical. What can our listeners do? What are some specific red flags that people should be looking for to spot potential fraud?
This is where being informed is so powerful. One of the simplest but most important things you can do is really take the time to review your Medicare Summary Notice. That's the statement you get every 3 months that lists all the services billed to your account.
So just being really thorough and looking over those statements.
Yeah. Check it carefully for any charges that seem wrong. Did you actually receive this service? Did you get that piece of equipment? If something seems off, don't ignore it.
Right, makes sense.
Another thing to look out for is being billed multiple times for the same service or item. Sometimes it's just a mistake, but it could also be a sign of something more serious.
Right. Okay, and what about the dates on those bills?
Absolutely. Make sure the dates of service on your bill actually match the dates when you saw the doctor or got the treatment. If they don't line up, that's a big warning sign.
Okay, good to know. Any other less obvious things to look out for?
Yeah, you have to be really careful with providers who say they know how to get Medicare to pay for things that are usually not covered.
Oh, right.
The National Council on Aging has specifically warned about this. It could be a sign of fraud. And be extra cautious if someone offers you free medical equipment or services and asks for your Medicare number. The Office of Inspector General has put out a lot of warnings about this. It's often a way to get your information for fraudulent billing.
The free thing always sounds so appealing, but I guess it can be a trap.
Exactly. And if a provider is really pushing you to get certain tests or procedures, but they're not clearly explaining why you need them, that's another red flag. And if you have access to your medical records, take a look at them every once in a while. Make sure the conditions and treatments listed there match up with your actual health history.
Right, so it's really about being aware and asking questions.
Exactly. Don't be afraid to speak up.
You talked earlier about fraud, abuse, and errors in Medicare. Could you explain those differences a bit more? Because it seems important to know what we're actually dealing with.
It is, and it can be a bit tricky. So, as we've discussed, fraud is intentional.
Okay.
It's deliberately deceiving Medicare to get money or benefits. Abuse, on the other hand, might not always be intentional, but it results in unnecessary costs to the program.
Okay.
Like, a provider might order way more tests than necessary, even if they aren't necessarily trying to commit fraud.
So it's more about practices that are wasteful or not following the rules, even if it's not outright deception?
Exactly. And then there are errors, which are just plain mistakes in billing or paperwork.
Right.
CMS knows these happen.
Yeah.
Like maybe someone accidentally puts in the wrong code for a service,
Yeah.
and that leads to an incorrect bill.
Okay, so to recap, fraud is intentional, abuse is improper or wasteful, and errors are just honest mistakes. But what if someone suspects something's wrong, but they aren't sure which category it falls into?
That's a great question. And, the best thing to do is report it anyway. Even if you're not totally sure if it's fraud, abuse, or an error, the authorities can look into it and figure out what's going on. Your report can actually help uncover bigger problems, even if your specific case turns out to be nothing.
Okay, so it's better to be safe than sorry. Report it and let the experts figure it out.
Absolutely.
So if someone does need to report Medicare fraud, How do they do it? What are the actual steps?
There are a few ways to do it, and they're all pretty easy to use. The main point of contact is the Office of Inspector General, the OIG.
Okay.
They're part of the Department of Health and Human Services.
Yeah.
And they have a hotline you can call. It's toll-free. 1-800-HHS-TIP-TFIs. That's 1-800-447-8477.
So you can just pick up the phone and call? Simple as that.
Exactly. Or, if you prefer, you can report it online. They have a form on their website, oag.hhs.gov, fraud report fraud. You can take your time, fill it out, and submit it. And of course, there's the Medicare hotline, 1-800-MEDICARE or 1-800-633-4227. It's available 24/7 for reporting fraud or abuse.
So there are options for everyone, whether you prefer the phone or doing online. What if someone's in a Medicare Advantage plan or a drug plan?
Good point. In those cases, you can report it directly to your plan. They have their own ways of investigating fraud within their networks.
Okay, that makes sense.
And if you're more of a letter writer, you can mail a report to Medicare Fraud, Office of Inspector General, HHS, TPS Hotline, P.O. Box 23489, Washington, D.C., 2026.
So many options. And we talked about the Senior Medicare Patrol before, the SMP. Can you remind us about them?
Absolutely. The SMP is an amazing resource, especially if you're feeling a little overwhelmed by all of this. They can help you understand your benefits, spot potential fraud, and they can even guide you through the process of reporting it. They have local offices and volunteers in every state so you can get personalized help. Their national hotline is 1-877-808-2468.
That sounds really helpful, especially if you're not sure where to start. When you do report something, what kind of information should you include?
The more specific you can be, the better. The OIG recommends giving your name and Medicare number so they can access your records.
Okay.
You'll also want to give them the name of the doctor, hospital, or company involved. And of course, details about the service or item you're questioning, including the date. If you can, include the amount that Medicare paid, which you can usually find on your summary notice. And most importantly, explain why you think this is fraud. Was the service never provided? Was the claim inaccurate? Whatever it is, lay it out for them.
So really, it's about painting a clear picture of what happened and why you're concerned?
Exactly. And if you have any emails, letters, or notes from conversations with the provider, include those too. But even if you don't have all the details, don't let that stop you from reporting. Sometimes even a little bit of information can be helpful.
That's good to know. You know, a lot of people might worry about their privacy if they report something. What can you tell us about that?
I understand that concern. When you report to the OIG, you can choose to stay completely anonymous. You don't have to give them your name or any contact information if you don't want to.
Okay.
And if you do give them your information, they make every effort to keep it confidential, at least in the beginning stages of their review. Plus, there are laws in place, specifically the False Claims Act, that protect whistleblowers.
Whistleblowers?
Yeah, people who report fraud against the government. These laws are meant to protect people from retaliation, things like getting fired, demoted, or harassed for speaking up. And there's IPRA, the law that protects your medical privacy.
Okay. So there are protections in place for people who do the right thing and report fraud. So what happens after a report is filed? What does the process look like from there?
Once a report comes in, it gets reviewed by trained professionals, usually at the OIG or Medicare. They'll look at what you've provided and decide if there's enough to start a formal investigation.
Okay.
And if they do investigate, what they do next really depends on the specific case. It might involve reviewing documents, interviewing people, analyzing data, or any number of other investigative techniques.
Sounds pretty thorough.
It is.
Yeah.
They want to make sure they get to the bottom of it. Now, how long it takes can vary a lot. Some cases are pretty straightforward and wrap up quickly. But more complex ones, especially ones involving big schemes or lots of money, those can take months or even years to fully investigate.
Wow. That's a long time.
It can be. And because of privacy laws and confidentiality, you might not get updates on the case, even if you gave your contact info.
Right. That makes sense. They can't be sharing details while they're investigating. You mentioned the possibility of a reward for reporting fraud earlier.
Right.
Can you tell us more about that?
Sure. So under the False Claims Act, if your report leads to the government recovering money from fraud, you might be eligible for a reward. It can be a pretty significant chunk, sometimes up to 30% of what they recover.
Wow, 30%. That's a lot.
It is. But it's important to remember that most reports don't actually end up with a reward. The main reason to report fraud should be to protect Medicare and the people who depend on it. The reward is really just a bonus.
Okay, that makes sense. It's encouraging to know that these efforts do make a difference. Do you have any examples of successful cases?
Definitely. We see successful prosecutions and recoveries happening all the time. For example, in 2021 alone, the Department of Justice recovered over $5 billion in settlements and judgments related to fraud and false claims.
$5 billion. That's a huge number.
It is. And a good chunk of that was from healthcare and Medicare fraud. There's also the Medicare Fraud Strike Force, a joint effort by the DOJ and HHS. They've been really effective at going after large-scale fraud, charging thousands of people who've collectively billed Medicare for billions in false claims.
That's good to hear.
It shows that they're taking this seriously. And we have specific cases, too. For example, one healthcare company had to pay $48 million to settle allegations of submitting false claims for rehab therapy that wasn't even necessary.
Wow.
And in another case, a whole network of doctors and facilities paid over $100 million for doing unnecessary procedures and taking illegal kickbacks. These are just a couple of examples, but they show how these investigations can really make an impact. And remember, a lot of these big cases started with a tip from someone who noticed something wasn't right.
Right. So it really does matter. It makes you realize how important it is to be vigilant and speak up if you see something suspicious. Okay, so beyond just reporting, are there things people can do to prevent themselves from becoming victims of Medicare fraud in the first place?
Absolutely. Prevention is so important. The National Council on Aging has a great piece of advice. Treat your Medicare number like it's your credit card.
That's a good analogy.
Right. Don't give it out to just anyone. Only share it with your trusted healthcare providers when you're actually getting services. Never give it to someone who calls you out of the blue or shows up in your door offering free stuff. And always, always review your Medicare statements carefully. Look for anything that seems off. Did you get those services? Were you charged twice for something? Anything suspicious, call Medicare and ask about it.
So being careful with your information and checking your bills are key.
Exactly. Also, be wary of providers who are always offering to waive your copays or give you free services to get you in the door. The American Medical Association has flagged that as a common tactic for fraud. Remember, Medicare won't call you to sell you things or ask for your personal information. If you get a call like that, hang up. It's a scam. And if you're ever unsure about a charge or something you hear about your Medicare benefits, call 1-800-Medicare. Use the number on your card, not any number someone gives you.
That's great advice. Very practical and actionable. Okay, so let's recap what we've covered today. We talked about what Medicare fraud is, the different forms it takes, and the serious consequences it can have. We looked at how to spot red flags, the difference between fraud, abuse, and errors, and the steps to take if you need to report something. We also covered how to protect yourself and how to be proactive in preventing fraud. It's clear that fighting Medicare fraud is everyone's responsibility.
I completely agree. Staying informed, being vigilant, and taking those proactive steps are all critical for keeping this vital program strong and healthy, not just for ourselves, but for everyone who will need it in the future.
Absolutely. We'll be sure to include links to all the resources we mentioned, like CMS, OIG, Medicare.gov, the Department of Justice, AARP, and the Senior Medicare Patrol in the episode description. We encourage you to check those out for even more information. And please share what you've learned today with other Medicare beneficiaries you know. Spreading awareness is one of the best ways to fight fraud.
Exactly. It's about empowering each other.
Right. And here's a final thought to consider. Even small actions, like being aware and reporting suspicious activity, can make a big difference in protecting Medicare. Together, we can create a healthcare system that's ethical, sustainable, and trustworthy.
I think that's a great note to end on. It's about collective action. Every individual plays a part.
Absolutely. Okay, well, that's our deep dive for today. Thanks for joining us. We'll see you next time.
See you then.